Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. A 3-minute EEG test may soon help detect Alzheimer's risk earlier. Researchers used a technique called fastball EEG to identify memory problems in people with amnestic mild cognitive impairment, a group prone to Alzheimer's disease. The test measures brain responses to repeated images and reduced responses signal impairment. It can be conducted at home, making it more accessible and less anxiety-inducing. Larger and more diverse trials are needed before it can be adopted in clinics. A new study has linked smartphone use on the toilet to a higher risk of hemorrhoids. Surveying 125 adults, researchers found that prolonged toilet phone use was associated with a 46% increase in risk. Over 1/3 of users exceeded the safe 5-minute sitting limit, with younger adults being more likely to use smartphones in bathrooms. Experts advise limiting sitting time and avoiding phone use for better hygiene and health. In the UK, the government plans to ban energy drink sales to individuals under 16. Brands such as Red Bull, Monster, and Prime will no longer be available to minors. 1/3 of children currently consume energy drinks weekly. Risks include heart strain, sleep disruption, obesity, and in rare cases, caffeine-related deaths. A 12-week consultation will finalize the law, reflecting growing concerns from parents and teachers. Artificial sweeteners have been linked to faster brain aging. An 8-year study involving nearly 13,000 Brazilians found that high intake was tied to a 62% acceleration in cognitive decline, equivalent to about 1.6 years of brain aging. The effect was more pronounced in younger adults under 60 and diabetics. Substances such as aspartame, saccharin, and erythritol were implicated, while tagatose appeared exempt. Experts emphasize the need for further research. 2 large studies have cast doubt on the routine use of beta blockers after heart attack. For patients with near-normal heart function, no survival benefit was observed. Among women, higher doses were linked to increased complications and mortality. Benefits remain clear for those with arrhythmia or hypertension. Researchers suggest that clinical guidelines should be revised to promote more personalized care. New research has connected immune cells in the brain to depression. In stressed mice, neutrophils mobilized from skull marrow to the meninges, where they triggered depressive behavior. These cells persisted even after stress exposure, altering brain inflammation. Blocking inflammatory pathways improved symptoms in models, suggesting a potential immune-linked subtype of depression and a new direction for treatment. Plant-based microbeads derived from green tea and seaweed show promise for weight loss. In animal studies, the beads trapped fat in the intestines, reducing absorption. Mice on high-fat diets lost over 17% of their body weight without gut discomfort. Reduced liver damage was also observed. Early human trials are now underway, positioning this as a potential drug-free therapy for obesity. A nasal spray containing azelastine has been shown to prevent COVID-19 infection. In a controlled trial with 450 adults, participants using the spray had a 69% lower infection rate compared to placebo. Only 2.2% developed COVID-19 after 56 days, versus 6.7% in the placebo group. The spray also delayed infection onset and reduced other respiratory illnesses. Electrical stimulation is being investigated as a way to reprogram the immune system. Researchers demonstrated that electrical pulses shifted macrophages into an anti-inflammatory state, enhanced stem cell attraction, and promoted new blood vessel growth. The experiments were performed using human blood cells, supporting future translational potential. This approach may lead to non-invasive therapies for inflammation and healing. Finally, sex differences appeared to shape the course of schizophrenia and bipolar disorder. Women with schizophrenia tended to start treatment later, while men had higher rates of substance use. In bipolar disorder, patients showed better cognitive performance than those with schizophrenia, with women excelling in memory and processing speed. Both conditions were linked to higher rates of thyroid disorders. These findings support the need for sex-specific approaches in mental health treatment. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting.